Hello everyone. In this video, you will learn what Ebola is and how it works. Ebola virus disease, or just Ebola, is caused by many viruses from the genus Ebola virus, such as Ortho-Ebola virus Zaire. Although it can be fatal, it is exceedingly rare. After contact with Ebola, the incubation period begins, which usually lasts for 2 to 21 days. The first symptoms can occur without warning and appear suddenly, including fever, fatigue, muscle pain, headache, and sore throat, followed by vomiting, diarrhea, rash, internal bleeding, and external bleeding. Finally, Ebola causes liver and kidney failure. If someone is lucky enough to survive and recover from Ebola, they can experience headaches, eye pain, fatigue, weight gain, hair loss, insomnia, amnesia, hearing loss, depression, and anxiety. Someone who has been to a place where there is Ebola, such as Sierra Leone, and are experiencing symptoms, or they have been in contact with someone who has Ebola, they should report it to a healthcare provider immediately. An incubation period is the time it takes between exposure to experiencing symptoms. While you may seem fine, the virus is already at work, hijacking your body. Unlike diseases such as COVID-19, which can spread without symptoms, someone infected with Ebola cannot spread the disease during the incubation period. Treatment of Ebola relies on giving the patient fluids orally and intravenously, and in some cases blood transfusions and injecting antibodies can help. However, there is no approved cure yet. The type of Ebola commonly found in Guinea and the DRC has an effective vaccine. It works by switching the genes of a chimpanzee flu virus with ones from Ebola, which allows the immune system to prepare for the pathogen by constructing antibodies. Like most other viruses, washing hands frequently helps prevent being infected. To further prevent the spread of Ebola, avoid contact with someone that has Ebola, including corpses who have died from the virus. Moreover, those who are at risk of getting Ebola should take the vaccine. Anyone can contract Ebola, however, those who work with Ebola patients, such as nurses, are at a higher chance of being infected. Additionally, laboratory workers, people who work with wild animals, such as bats, and burial teams, are also more likely to be infected with Ebola because they could be exposed to the virus. Ebola's mortality rate is not 100%, but can range from 25% to 90%, with the average death rate at 50%. Treatment as soon as symptoms show can further reduce death. Ebola can only spread through direct contact with the virus in bodily fluids from the body of an infected person or animal. It cannot spread via water, air, or properly cooked food. However, preparing food could expose you to Ebola. Ebola was discovered and documented in the year 1976 in modern-day Democratic Republic of the Congo by Jean-Jacques Muyembe Tamfum and Peter Pio after 2 outbreaks. Since then, Ebola has appeared periodically from an unknown animal host to infect humans in a handful of African nations. The worst outbreak occurred in 2014 that lasted 2 years with over 29,000 cases and claiming over 11,000 people. The shape of the virus looks like a worm with spikes on the outside, made of protein material and a protein matrix to provide support. On the inside, there are coiled up RNA and loose enzymes. These are for infecting a cell. Ebola is so hard to deal with because it targets immune cells, hindering your immune system before they even detect Ebola's presence. It can enter a cell by binding onto special receptors on the cell. Ebola first attacks dendritic cells, which are the brains of the immune system, taking the cell's control and stimulates it to create billions of Ebola virus before killing it. Secondly, Ebola infects other immune cells responsible for killing viruses and infected cells. Additionally, Ebola infects macrophages and monocytes, making them create pores in blood vessels, causing internal bleeding. Ebola then makes its way to the liver and kidneys, killing their cells hastily, causing multiple organ failure and more internal bleeding. A future study could focus on creating a rapid diagnostic tool for Ebola, like the rapid antigen tests for COVID. The research could help create a cheap, portable, and easy-to-use test that can make a diagnosis of Ebola in lieu of our current diagnostic methods that involve expensive equipment. Dispatching them to areas of high risk can improve early detection, helping us contain future outbreaks better and faster, decreasing exposure and improving their chances of living by detecting Ebola quicker, resulting in receiving treatment quicker.